Welcome, everyone. Today we'll be exploring biohazardous waste management in the clinical laboratory, one of the most critical areas for ensuring both personal and environmental safety. By the end of this session, you'll understand the classifications of biohazardous waste, proper handling procedures, and regulatory guidelines that every MLS professional must follow. Biohazardous waste refers to any material that contains potentially infectious agents or biological toxins. In the lab, this could be blood-soaked materials, bacterial cultures, or any specimen that could spread disease if improperly handled. Biohazardous waste isn't all the same. We categorize it to ensure correct disposal. For instance, sharps require puncture-proof containers, while tissue samples demand incineration. Recognizing these categories is the first step toward effective management. In a medical laboratory, waste is produced at nearly every workstation. Think of used pipette tips, contaminated gloves, or slides with patient samples. All can pose infection risks if mishandled. Proper waste management is not only a safety practice, it's a professional responsibility. A single exposure incident can lead to serious infections, and improper disposal can contaminate the environment or breach health regulations. Color coding ensures that each type of waste is easily identified. For example, red bags signal infectious material, while yellow sharps containers are designed for puncture resistance. Labeling with the biohazard symbol is also mandatory. The golden rule is segregate waste where it's produced. Always wear gloves, lab coats, and face protection. Overfilled containers are dangerous. They can spill or puncture, leading to exposure incidents. Once collected, biohazardous waste must be stored safely until disposal. Containers should remain sealed and marked, and only authorized, trained staff should move them to storage or treatment areas. The goal of treatment is to destroy pathogens before final disposal. Autoclaving is most common in labs for sterilizing microbiological waste, while incineration handles sharps and tissues that cannot be sterilized effectively. Every country and institution follows specific waste management laws. As future laboratory scientists, understanding these regulations ensures compliance and reinforces public trust in our profession. Accidents can happen even in well-managed labs. When spills occur, safety comes first. Never clean up without PPE, and always follow your institution's spill response protocol. Waste management is a continuous process. Regular training and safety audits help maintain standards and prevent complacency. Encourage your peers to report unsafe practices before they cause harm. Here's a real-world example. A technologist sustained a needle stick injury while discarding a syringe. Prompt reporting and follow-up prevented infection, and it led the lab to revise its sharps disposal process to prevent recurrence. To wrap up, remember, every piece of waste tells a story about your lab's professionalism and safety culture. Handle biohazardous waste with respect and diligence. It's one of the cornerstones of laboratory practice.